Hey, what's up guys? It's Victor from Cyborg for Life, and yeah, I'm actually in my car right now, not my office, but I am headed to Sinai Hospital to work on a top secret project. Just kidding. But I'm going back to my old limb lengthening stomping grounds. I haven't been back there pretty much since the procedure about 8 years ago. Well, I was there like a year or two after for a final checkup and stuff, but it's crazy. It's like I'm driving down memory lane right now, and I just wanted to kind of like shoot this quick video because I wanted you to know that if you're considering limb lengthening procedure, or if you're scheduled for your procedure, that you need to kind of have like that deep internal reflection to make sure that your conviction, your decision to get this done is a strong one, because you don't want to go into it and say, you know, half-heartedly put one foot into the pond or the pool, if you will. You want to kind of, you have to kind of go all in, take the plunge, if you will, because it's a very involved procedure. Yeah, the surgeon can do their job, and you know, hopefully they do a really good job and stuff like that. But the thing is that once you come up out of the surgery, I'd say that 80% of that is going to be you, all you. Then the other 20% is like the physical therapist and the doctor checkups if anything happens. So you're going to kind of like have that internal reflection going there. And I had to shoot this video because of the fact that I'm driving back there, and I'm getting kind of, you know, the same feeling. It's like, man, it's just like time flew, but that same, and all the flashbacks are coming back to me right now. It's like, man, I got there, my dad dropped me off that day. It was like countdown to D-Day. Got in the surgery waiting room, got called back, you know, saw the team, the surgical team, and then, you know, Dr. Kami came in, marked my leg, and the rest is history. So it's pretty cool to kind of reflect on that now. And now that I'm, you know, revisiting this whole limb lengthening procedure thing, and my whole channel with you guys, and sharing the whole, spreading awareness of limb lengthening in general. I think it's a super powerful thing, because this surgery is, it's around to stay. There's people who are going to have congenital problems for deformities and discrepancies. There's people who are going to want, you know, people with dwarfism who want stature lengthening, people who want cosmetic limb lengthening, you know, kids who have all kinds of different reasons that they need lengthening done. This procedure is a necessary procedure, and I'm driving back to one of the best centers in the world right now. It's just crazy that, you know, since I moved back to Baltimore after grad school, it's just it's pretty surreal, you know, just to kind of like reflect on this. So I know these 2.5 minutes I just wasted kind of chatting, it's a waste of time, but anyway, I'll let you guys see what I'm doing. All right.
Perfect.
Stretch versus any sort of lower back stretch.
This is the first one?
That's the second one.
That's it?
Yeah, that's good. On the stretch position, so you're going to let your stretch slide dangle off the edge of the mat and let that knee relax. See it?
I'm just tight.
That's okay.
That's what it is.
That's okay. I was like, I don't know if he's not coming off. Okay, yeah, you are. There you go. If you could just bring it out to the side a little, that's good. Oh, that's better. So the second position.
I'm getting ready for surgery again. I'm marking the legs. Dr. Conway.
I know, right? I promise not to cut into the wrong one.
Yeah, she came into the surgery that morning, and she was like, take the marker. I was like, oh, it's the left one. I was like making sure.
Just so you know, just so you know. What we just put on were two sensors, and what they have in them is an accelerometer, a gyroscope, and a pedometer. So we're going to use more so the gyroscope and the accelerometer component of it. And what it's going to look like with his squatting, single leg squatting, and we can also look at hopping. It'll look at his depth of his squat, his control of his squat, and then how much dynamic varus or valgus, meaning the knee diving outward or inwards when he squats as well, and when he hops also. Go. 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 Yeah. Okay, perfect.
Give me some barbells.
Yeah.
Oh, okay, you got it.
So what we want to see is how symmetrical is he running? Is he offloading the operated side? Does he let control on the operated side? How is he landing the cannons? What kind of forces are going through their So
Is it?
That was just extra.
What's that?
that was just a bonus.
I see. It's the most cardio I did all week.
And then if you want, you can take a picture of. Victor, are you okay if he takes a picture of your room?
Hey everybody, this is Victor from Cyborg for Life, and today I'm here with Annie from Sinai Hospital, and I just want to ask her a few questions about why physical therapy and stretching pre-limb lengthening is important. So Annie, first of all, thank you for joining me. So can you give me your perspective of why you think that physical therapy and stretching pre-op is important for a limb lengthening patient?
Absolutely. Yeah, and this is one thing I wish like everybody kind of knew before they were going into the surgery, is to be able to be aware of what muscle groups tend to get really tight during a lengthening procedure. So the basics of a lengthening is basically there's typically a rod involved with the bone itself that's being lengthened, and then you're asking those muscles to keep up. So if you can actually jump ahead of the game and get into a preoperative stretching routine or mobility routine, it actually helps you in the long run during your lengthening process to avoid you getting things like knee flexion contractures, hip flexion contractures, so that your rehab will be more effective for you and your post-operative recovery time will hopefully be more efficient for you as well.
Gotcha. Some surgeons out there that say that it's genetic, it's not going to improve it, but have you, from your perspective, seen patients come in who haven't stretched do better than patients who have prepared?
Yeah, it's hard to say, it's hard to answer that question honestly, because I don't typically know the dosing and the amount of stretching the patient has done prior to. I would say if a patient is typically involved with some sort of mobility program, whether it be a yoga routine or a stretching routine, or they're overall just more active and their joints and their muscles are used to going through a greater range of motion on a daily basis versus someone who's sedentary,
Right.
they almost always do much better. Now there's a lot of other factors that go into the lengthening procedure. There's a lot of other things that you have to take into account, but from my perspective, the more active, the more flexible, and the more mobile you are prior to the surgery, the better your outcomes are afterwards.
Very cool. How far into the consolidation or recovery phase should they say, hey, I need to keep stretching? Or is it like 1 year post-op, 2 years post-op? When's that line where they can say, okay, I can kind of dial back on my stretching?
Yeah, so while you're during the lengthening phase, so you're actually you've had the lengthening procedure and you're now still lengthening, meaning you're gaining height or gaining bone length every week. You want to be doing actual formalized physical therapy daily or every other day, depending on one, how much length are you trying to get, and two, the bone consolidation phase as well. So, and that's not just for flexibility, that's for strength also. So it's typically, you want to be in some form of formal therapy during that time so that you can make sure you're efficiently stretching as well and you're not just going through the motions and not actually getting an adequate stretch or mobility plan. Now, once you're done lengthening, typically that can be really dependent on how flexible is the person coming in and what types of activities do they want to get back to doing.
Right.
So that all depends. It would have to be kind of a patient by patient basis of if it's someone like you who wants to be able to do, you know, a deeper squat, or they want to be able to do lunges, or if it's someone who's a collegiate track athlete and they do hurdles and their hamstring flexibility has to be something insane, or they're a dancer and they have to do all of these types of motions.
Yeah.
It really depends on who that patient is and what their goals are for how long after they have to maintain that stretch. Generally, it's typically a daily stretch routine is good to follow through maybe 6 months after you're done with the lengthening process.
Okay.
But again, it's really patient dependent.
Very cool. Well, Annie, I want to thank you. You're doing a wonderful job here at Sinai in the Gait Lab and the Rehab Center. So everybody, you can go ahead and follow Annie. We'll put her links in the description. And yeah. I forgot.
Here, you want help? I can help you. Hold on. I got you.
Okay.
This is why I'm here, really. So here, it's just going to be one, and it's just going to come over this one shoulder. There you go. Perfect.